pharmacists are essential partners of a functional medicine care team. Doctors Melody Hartzler and Lara Zakaria continue the discussion on nutrient depletion and how pharmacists can work with primary care providers to identify areas of support for patient health.
People find functional medicine because they're so excited about it being lifestyle focused and nutrition focused. And oftentimes they are specifically trying to avoid having to use a medication. But they might come in, they have hypertension, they have something that actually would really benefit from pharmaceutical treatment. How do we talk to them about the potential nutrient depletions in a patient that's already not super excited about
Yeah.
pharmaceuticals, and making it, approachable and having them feel confident that we have the skills to kind of balance these issues?
Yeah. I always talk about things as tools in our toolkit. We have a tool of this drug therapy, we have the tool of the nutraceutical, and we also have risk, right? So we have a risk of if your blood pressure remains high and you increase your risk for kidney disease or, other, cardiovascular complications. And I also, normally bring in the conversation of, the earlier we get your blood pressure controlled, the earlier we get your blood sugar controlled, we also have better outcomes because we don't have this metabolic memory piece. And so sometimes we frame it as we're going to use this tool, this drug therapy tool, for this period of time while we work on the lifestyle modifications, because yes, weight loss can bring down your blood pressure, but do I want to wait 6 months to a year for you to bring down your weight enough to affect your blood pressure? So when we frame use of drugs in that ways, especially for chronic disease, we're not talking about rare disease or acute things that need treated like infections with medications, but I think helping them understand that drugs aren't always like the evil thing. Like there's a reason that we have this modern information, and sometimes the use of drugs can be really helpful to them. Bringing in, like when we're talking about side effects of drugs, I also bring up that there's side effects to nutraceuticals too. So it's not always just, a side effect or a nutrient depletion related to a drug. There can be things that happen if we take too much zinc, we get our copper imbalance. And so that also is sort of, and not that it's necessarily a depletion, but there are ways we can throw the body out of balance. We can methylate too much and cause issues there with people throwing all kinds of methylated B vitamins. So I just try to explain that they're not like these opposing things all the time, and that they're probably pretty more similar. We got drugs derived from a lot of plant-based things, so we're really just using a different tool. And when we're talking about statins, I think that conversations with the CoQ10, we know that we need to supplement with CoQ10. So that's one thing we're going to be asking, like someone, okay, if we are recommending you take a statin, we're going to recommend that you take 100 milligrams at least, maybe 200 milligrams of CoQ10 a day. And, but it also depends on the risk. Are they a primary prevention patient? Have they had a heart attack before? Did their dad die at 50 of heart disease? So there's so much other nuance to, I think, the whole conversation with a patient, and helping them understand like why drug therapy may be your best option right now. And also, I think helping them understand that drug therapy isn't always a forever thing. Most people think they get started on a drug, I'm going to take this for the rest of my life, when it's related to a chronic disease. And so they're always, fearful of that decision, because they feel like whatever decision they're making in the office today means that this is the decision they're making forever. And I think helping them understand that that's not necessarily the case either. So understanding that, while we work on these lifestyle things, like our goal is to deprescribe these drugs if we can. But again, like safety and efficacy conversations, and what the risk benefit. I mean, there's always a risk to everything we do. There's a risk walking across the street. There's a risk if I decide to travel or I don't decide to travel, or if I take a car or I take a plane. So anything they choose to do, whether it's a nutraceutical or a drug, is always going to come with some conversation. So trying to make them not like opposing things, but sort of like both options in our toolkit, I think has been my approach to things.
I love using that analogy of a toolkit, because it truly is just another option, right? And we have data that helps guide some of those decisions. And then there's personal needs and family history and genetics that are really going to shift for one person or another. I like to give some specific examples. Like antibiotics is my go-to example of just the vast change that we've seen in public health with the advent of antibiotics. Now, could they be overprescribed? Absolutely. Can they create unintended consequences in terms of disrupting the microbiome and the gut health? And yeah, that's all absolutely part of the conversation. But sometimes we have to use that tool in order to save somebody's life, right? And that is going to then mean, okay, well, that's step one. Step two is now how do we reverse some of the adverse reactions that we saw as a result of needing that particular intervention. The other example that I give is in hormone replacement therapy, specifically thyroid. I find too often my patients assume that having to take thyroid medication means that they lost the battle somehow, that needing to take it or not being able to discontinue it means that they're not doing a good job in terms of managing their thyroid condition. And that's one of the first, goals that a lot of people will share with me when they're working with me on their thyroid health. And part of it is, well, you need thyroid hormone. It's kind of the master metabolite. She is very important in terms of every single function that we have in the body. So if you are not able to make enough thyroid, that is a life-threatening condition in my opinion. It starts off with superficial things like losing your hair, changing your skin texture, changing your nail beds. And it just very quickly evolves into being more and more serious if we don't actually address that deficiency. And there's no shame in actually needed to take a replacement. The other myth that I hear around this is around levothyroxine somehow being inferior to bioidentical hormones or T3, T4 compounds. And I don't think that's true for everybody. I think some people do really well on levothyroxine, and we've done an amazing job in public health of being able to get a cheap medication out to the masses to help to supplement their thyroid function. But what we can do if you're not indicated for a bioidentical or a T3, T4 combination is actually improve the conversion of T4 to T3. And I think that's a missing conversation, that you actually need certain nutrients, particularly zinc, vitamin A, vitamin E, antioxidants to help to improve the conversion from the inactive T4 to the active T3. And then from there, making sure that T3 interacts well with the cell receptor so that it goes on to open that door and do the job that it's supposed to do metabolically. And I think this really starts to open the conversation about empowering the patient with things that they can actively do. They can seek out foods that have these particular nutrients in them. If needed, we can supplement them with supplements, right? We can talk about the lifestyle prescription and how stress impacts that conversion and impacts that interaction with the cell receptor. We could talk about an anti-inflammatory diet and the role of antioxidants, right? We could start talking about how other hormones start to impact thyroid function, like insulin resistance and estrogen levels and things like that. And of course, we could talk about the foundational gut health component so that all of these things are functioning synergistically. And I think to me that conversation starts to shift from I have to take this HRT to how do I make this HRT work best for me?